What if I told you there's a better way to decide between mesothelioma treatments? Today I'm sharing our 4-step process. It helps many patients make this critical decision with their doctors. You won't be making this decision alone, but it will give you the tools to have an educated conversation with your doctors. And most importantly, I'm going to show you how to avoid common mistakes that could cost you precious time. Hi, I'm Deborah from Surviving Mesothelioma. For almost 20 years, we have helped thousands of patients understand their treatment options. Everything I share comes from patient experiences, interviews with top mesothelioma specialists, and research from medical journals. All right, let's take a look at the 4 steps. Know your exact diagnoses, understand your treatment goals, evaluate your options, make the decision with your doctor. Step 1, know your exact diagnoses. Before you can make any treatment decisions, you need to confirm 3 critical things with your doctor. First, what type of mesothelioma do you have? There are 4 types. Pleural, affecting the lungs, peritoneal in the abdomen, pericardial around the heart, and then testicular. Each type has different treatment options. For example, if you have pleural mesothelioma, you might be looking at a pleurectomy, decortication, or PD. But if you have peritoneal mesothelioma, you might be a candidate for HIPEC surgery. Second, what's your cell type? Is it epithelioid, sarcomatoid, or biphasic? Now, this matters because epithelioid usually responds better to standard treatments. Studies show immunotherapy works particularly well with non-epithelioid types. And then third, what stage is your disease in? Earlier stages usually have more treatment options. So for example, major surgery might be possible in earlier stages, but not in later stages. Here's something really important. Before making any decisions, it's usually a good idea to get a second opinion about your diagnoses, because getting the right treatment the first time isn't just important, it may be critical. And here's why. If you decide to do chemotherapy and you use the wrong chemotherapy drug, you're not just wasting time. You could be making the cancer harder to kill. Here's what happens. The weaker cancer cells die off, but the stronger ones, they survive and then they multiply. Now you've got a tumor full of champion fighters that are stronger than ever against that same drug. This is called cancer cell resistance. But here's what's crazy. Most patients, they're afraid to ask for a second opinion. They worry about hurting their doctor's feelings. But let's be real here. Your life is worth more than someone's feelings. How exactly do you get that second opinion? All right, number 1, tell your doctor this exact phrase. I'd like to get a second opinion to confirm my diagnoses. Could you help me arrange that? And then 2, have them send your biopsy slides and scans to a major cancer center with mesothelioma specialists. And then that's it. Okay, here's what's interesting. Most doctors don't have any problem with getting a second opinion. Why? Because it's a normal part of cancer care. They know that getting it right the first time could mean the difference between a tumor that responds to treatment and one that becomes a drug-resistant super army. Another way to ensure that you're getting the best possible guidance is to consider a multidisciplinary care team. Okay, this means having not just an oncologist, but also surgeons, radiologists, nutritionists, palliative care specialists, and then other professionals who specialize in mesothelioma. Okay, these teams work together to review your case, and they're ensuring that you benefit from multiple perspectives and the latest research. Let's look at step 2, understanding your treatment goals. So now this is where you need to think about what matters most to you. Some patients focus on living longer through treatments like immunotherapy or HIPEC surgery or multimodal therapies. Others prioritize feeling better and maintaining their quality of life through palliative and alternative approaches. Neither choice is wrong. It's about what is right for you. Your age, your overall health, your personal priorities all play a role here. So let's take a closer look. Life-extending treatments aim to help you live longer. However, there's no guarantees. These treatments are usually more intense, like major surgery or combined chemotherapy treatments, and studies show options like HIPEC surgery have helped some peritoneal patients live a median of 53 months, but these treatments often require good overall health, longer hospital stays, and longer recovery times. Palliative treatments focus on helping you feel better. They can reduce the pain, make breathing easier, and improve your daily life. While they might not extend life as much as other treatments, many patients choose this path to just maintain better quality of life. So take time to think about your goals. What matters most to you? Are you willing to handle more intense treatment for a chance at longer survival? Or would you prefer treatments that focus on maintaining your quality of life? Let's move to step 3, evaluating your options. Okay, once you know your exact diagnoses and your goals, now it's time to look at specific treatments. Now let's break these into 3 categories. First, standard treatment. These include surgery, chemotherapy, and the newest option, immunotherapy. Studies show immunotherapy drugs like nivolumab plus ipilimumab help some mesothelioma patients to live a median of 18.1 months compared to 14.1 months with standard chemotherapy. Second, clinical trials. Okay, these test new treatments that might work better than current options. But here's the thing about trials. Since these are new treatments being tested, there are additional risks. The new treatment might not work as well as standard options, or you might experience side effects that doctors just don't yet know about. Some trials use placebos, which means you might not get the new treatment at all. If you're interested in the clinical trial, have your doctor help you find one that you might qualify for, and then before joining, ask, what phase is the trial in? What are the known risks? What kind of testing will I need? Can I stay on my current treatment? Additionally, some centers now offer genomic or biomarker testing. This personalized approach can help identify targeted therapies that are more likely to be effective based on the unique characteristics of your tumor. While still evolving, these strategies represent the cutting edge of cancer care, and they may improve outcomes for certain patients. Third, alternative approaches. And this brings me to an important point. Some long-term survivors have taken a completely different path. Take Paul Kraus, for example. So he became the longest living mesothelioma survivor in the world by choosing alternative treatments, like getting high-dose vitamin C given through an IV. He lived for 27 years after his diagnoses. But remember, the approaches that he used are not FDA approved. Some patients, combine standard treatments with alternative approaches, while others, like Paul, choose to focus on alternative methods. The key here is working with experienced healthcare professionals who can guide you, whichever path that you choose. Now let's move to step 4, making your decision. Ask yourself these key questions. Can you handle the treatment physically? Does it align with your goals? What's the time commitment? How will it affect your daily life? But please watch out for these red flags. Pressure to decide quickly. One-size-fits-all approaches. Doctors dismissing your concerns or questions. Choosing doctors because they are, quote, nice, instead of their experience. Here are 3 common mistakes that I have seen patients make. First, some patients make the mistake of rushing into treatment without all of the information. And yes, you want to start treatment, but take the time that you need to research different treatments so that you feel really comfortable with your decision. I've also seen the complete opposite happen, where some patients take too long to decide and ends up reducing the treatment options that are available to them because the cancer is progressing so quickly. And then second, some patients make the mistake of choosing the treatment based only on survival statistics. Now remember, those numbers are averages and they're not guarantees. And then third, some patients make the mistake of just not taking an active role in their care. And this last point, okay, it's really important. The most successful patients that I have seen take charge of their survival journey. They don't just passively accept what they're told. They expand their universe of treatment options. They get second or even third opinions, and then they just modify their lifestyle to support their treatments with their doctor's help. They ask lots of questions during doctor's visits. They keep detailed notes about their symptoms, their side effects. They build a support team of experienced doctors that they trust, and they stay open to adjusting their treatment plan as needed. And remember, you are not just a patient. You are the CEO of your own health. Your doctors are there to advise you, but ultimately, these are your decisions to make. And if you'd like to see how Paul became the longest living mesothelioma survivor, click the link in the description, get his book for free. You are going to get all of his survival strategies that he used to survive for over 27 years. That's all I've got for you today. Thanks for watching, and I'll see you in the next video.